Call the meeting to order.
Oh.
We get a chance to look over the agenda for an approval.
I would move to approve the agenda.
I'll second it.
All those in favor?
Aye.
All those opposed? Okay. Transit Palace contract. Oh, minutes, sorry, we need to approve the minutes from last meeting. Everybody get a chance to look over them?
I'd make a motion to approve the minutes from the previous.
I'll second it.
Okay. All those in favor?
Aye. Aye.
All opposed? Okay. Now Palace Transit contracts.
Okay, in your packets, we got the list this time of the contracts. The ones highlighted in yellow are the ones that are due for this meeting. And there is no changes to anything.
I would move we approve those contracts.
I'll second it.
All those in favor?
Aye.
Those opposed? Okay. Anything else with that one? No. Okay, transit radios.
Okay, so our current CB radios that the buses use will, I believe in 2021, I'm thinking, will become obsolete, and every person in the state who has radios will need to update the radios. I think it's 2021, but don't quote me. So when these radios become obsolete and we have to replace them, they run around $5,000 to $6,000 each to replace each and every one of them. We have received grant money in the past to replace radios as we need them, and I had grant money to replace these radios, but as we talked about at a previous meeting, a couple of transits has switched over to the FirstNet system. And the FirstNet system is your push-to-talk cellular radios. So we have now pursued going with we checked out AT&T and Verizon. AT&T had the best pricing and the options that we needed available for our program. And that's also what Brookings Area Transit and People's Transit out of Huron are using. They're using that system as well. So we pursued going along with the AT&T program, and we are now officially getting them set up. They're in my office. My office is all spread out in my office. Everything's getting set up. If you look at our Facebook page, I had a picture of everything with the AT&T representative setting things up. Then we have our IT person who will go and put the new SIM cards in the Cradle points that we currently have in the buses, and then we'll put the new tablets in the buses, and they'll all have that push-to-talk feature. And then we'll be on the FirstNet system, so that means we'll have priority. So if there is some kind of local emergency and the cell phone towers get overloaded, these phones and tablets have priority over everyone else. So we will be able to communicate with police and fire because they also have the AT&T FirstNet system, and will be part of that disaster unit response team. So it's moving, it's rolling along, and we have the grant money to cover it, so we're good.
Sounds awesome.
When does it actually go into effect? When we get them installed. Yeah, Okay.
Within the next month?
it should be in the next month, yes.
Okay. Good.
Everything is set up in my office. We just need to get the SIM cards in each and every bus, and he needs to, IT words, I don't know. Yeah, we need to get dispatch license, but there's some kind of IT word he has to format them, the SIM cards to fit in our Cradle points. Like I know the word Cradle points. And then the tablets do fit. We have new mounting brackets and holders to put these tablets in, and we'll be able to run our regular dispatch software on these tablets along with this push-to-talk feature. And it is just a microphone where you push to talk like we normally have.
Oh,
So it's not like you're talking to a cell phone or anything, it's still just a push-button
that's
radio.
And they won't become obsolete in 2 years.
Well, the tablets will probably wear out yearly,
Yeah.
but that's just a normal tablet for you. They're $99 tablets
They'll still work in the 2021.
But they'll
when
work,
everyone
yep.
else does that. Okay.
because it's all cellular data versus the CB radio system.
how many radios are involved?
15.
15?
Take
Wow.
that times 5,000.
Wow.
Program is also.
I thought it was 5,000 for all 15.
Uh-huh.
The program is pretty nice because you can track exactly where each bus is. You can track their route and where they are all the time.
and we didn't have that
We
before.
didn't have that before. Awesome.
That's a
Good.
nice
And
option.
then we can put what's called a geofence on. So say we have, we put a geofence around LifeQuest and they call and say, so-and-so's ready to go. We know which bus is by there and we can call just that bus and say, while you're there, pick that person up. Or if they're out at Grasslands, while they're there, pick that person up too and know where our buses are at. And then we can radio everybody all at once, or we can radio just 2 people, we can radio just 1 person.
That sounds awesome. Because one day I saw 3 buses within a block.
But a lot of times with that,
Yeah,
they might all be at that one spot one time, but they're going 3 different directions.
I know.
Right.
But yeah, I went, oh, I hope nobody else sees this.
And it's hard for the public to perceive what we do.
Yeah.
Vendor show recap.
We probably had one of the best vendor shows we've had so far. This was our 5th anniversary one. The bake sale went phenomenal. They had over $400 in the bake sale, over $200 in the kitchen for the lunch. And we had over 30 vendors. We did have a lot of last minute cancellations, but we were able to fill most of them. And we had over 600 attendees come through our doors. And we have a little clicker that a person does. And usually we get about 300, 350 people through our doors, and having over 600 was
Right.
tremendous. It was great weather. There was another vendor show at the fairgrounds, and there was a lot of open houses on Main Street. So I think all those 3 things contributed to our successful event. Plus, we sold our raffle tickets while we were there. Louise was the champion, sold 126 raffle tickets.
Good.
And we also had our nutrition tree up, our nutrition tree for giving, and got some donations for that as well. It was a very successful event this year.
I sold just a couple of them because I was pushing the quilt.
Go Tuck. Yep.
Now I'll have to push the other. So,
How did the vendors feel about it?
Yeah.
When I talked to everyone, I think there was only 2 of them that said they didn't sell much, but they had amazing foot traffic. But the other ones were extremely happy. One of them said this is her favorite event. It's better than the one she goes to at the Moose. She always sells more. The one that was right by the front door, she goes, I sold $400 worth of stuff within the first 2 hours. They were very happy with their turnout.
MVP and DW partnership.
So DW has had some change in staff, and we are meeting with new staff members out there. And before, they were having their own volunteer program, and they were trying to line up their students with the different nonprofits and volunteerism. And after the staff person left, they reached out to us and talked about just partnering with us and why reinvent the wheel, why duplicate services when we have this program already. So Amy and I went over and met with 3 staff members at Dakota Wesleyan, and they are now going to partner their students' volunteer program with us. They're going to run it through our Mitchell volunteer program. So the nonprofits can reach out to us, we can reach out to the college students, we can send them information, and they'll put it out to their students as well, saying this volunteer opportunity is available. They have flyers. We updated our forms online, so they are now fillable PDF forms, because in today's day and age, people don't want to handwrite things. I don't. So we have now PDF fillable forms on our website, and we are working with them on their partnership on their volunteer programming.
Got a lot more work for you, or not too bad?
Oh, yeah. Well,
It will be. It will be.
just for a fact for the programs and stuff
Yeah.
right now.
Yeah.
Breaking Bread Ministries.
So Breaking Bread Ministries reached out to us about they just wanted to get the information out about their program that they have. That's the Thanksgiving meal. And we talked to them about how in the past, when Randy Dosher was on our advisory board, we would help assist in paying for the meals that were over 60. So, and she didn't know anything about that because we can use our state funding because these meals do meet our DRIs. So they are going to they worked with Amy, they're gonna give a sign-up sheet, so anybody who is 60 or older, we can reimburse them the funds for their meals, so that way they can serve more people. And then we're also gonna help them, we're gonna put in volunteer requests, and we're gonna help them find volunteers, so they're gonna be part of our MVP program as well. And they also had Amy send out sign-up sheets, so they can have the meals delivered to some of our outlying sites, such as Green Ridge, Meadow Lawn, Cathedral Squares, and I think they're reaching with Westlake Acres too.
This is the meal that they do at the Westland Church.
Yes. So if
They
we,
said they were adding a couple more places at Life Quest too this year. Is that right? You know.
Not sure what you mean.
Just they're providing the meals. at
yeah, they're
some
delivering the
more-
meals instead of making people come
yes.
to.
Yes, okay.
Yes, now I know.
Yep.
At least 2 places.
Okay.
You know,
So
I think last year they did 1 place, but they're gonna do more than that this year.
cool.
Do like 3 homes.
Okay.
So,
They were asking me too if there's any other options, so I know
Yeah.
if you guys know
I
of
know
anything.
Brian was
reach
taking
out.
care of that, you know, lining up where they needed to go. So,
Good. I know it worked great for us last year because they actually brought the turkeys. Before they would just bring the box meals, you know, and pass them out when they got there. Now they actually serve them out of our steam table, which works great for them. They just, they bring everything that way, serve it out. They come a little early and get everything prepped and everything. And then the residents there end up with the leftovers too. So it really is a win for us. As well as a lot of the residents have their family come.
Right.
And like some of them will take them back to their apartment, some of them eat down in the community room. It's really, because they couldn't do it all at the Wesleyan Church because they'd run out of
Right.
room.
Room.
So it works great for everybody, I think.
That's
Who
awesome.
actually prepares the food and does all that?
The
Who's
volunteers do.
just volunteers?
Like I've got a group of volunteers that are gonna come to Green Ridge and they'll prepare all of our food for ours. Or most of it, I think.
Yeah. Oh, wow.
They are looking for volunteers.
Yeah, all right, okay.
Is People's Transit open on Thanksgiving?
No, we're not. Palace
Or sorry,
Transit.
not People's Transit, Palace Transit.
Yeah, no, we're not. We are open the day after Thanksgiving.
So then will those numbers go into our accounts then?
Yes,
Oh, yay.
that'd be great.
Okay. Anything else on that? Nutrition tree?
We're doing our nutrition tree again this year. I'm still working on getting names for it. We got quite a few names on the tree, but we're working on getting names for the tree. So, we said we had it up for the vendor show. We got some donations through there. And every year we've been doing pretty good. I think right now I'm at probably about 50 names. So,
Wow,
yeah.
that's quite a few.
And we like to make sure everybody gets a full ticket. That's priority.
A
I know
full,
last
one
year
full
we got
ticket.
to do 2 tickets.
Yeah. Are we planning something for the paper?
They usually come, yeah.
Yeah,
I've already reached
good,
out to JP. He's
Yeah.
going to contact me next week. Yeah.
good, because I think that really did help the last couple of years.
I tend to always have a guy come in like 2 weeks before the end and he'll ask how much you need to make the rest and he always writes me a check.
Oh,
If he's a farmer, he always writes me a check or whatever.
awesome.
Oh, nice.
He's done that the last few years.
Yeah.
Community services rate.
This is more informative on the next city council agenda. There will be, we are required to put our rates that we charge people or any contributions we ask for people. We are required by state law to have those fees set by the city council. And I have put in what they call a agenda request form. So it will be on the next city council agenda if you see it. And basically, it's all of our rates. So I have our nutrition one that shows our congregate meals, the $4 for suggested contribution, $6 if you're 60 or young, if you're under 60, our dine card, our second meals, I have those rates. And then on Palace Transit, I have all the fares for riding the bus, the advertising for both interior and exterior bus advertising, as well as token sponsors, how much we charge for token sponsors. For the volunteer program, I have the rates for the vendor shows, So you have the holiday vendor show, the summer outdoor vendor show, and then a possible Corn Palace Farm show. So if we do these, we have the rates set. And then for the James Valley Community Center, we have the membership rates, the rental rates, copies, facts, dance, bingo, advertising in the newsletter, farmers markets, literature rack, and the senior health and living show. So once these are set by city council, this is what we'll need to follow. We can't adjust anything until next year if we want to adjust any rates. So if you do feel that we need to adjust things, contact us before this time next year, and we'll put it on next year's city council agenda.
Citizens input.
Did you want to address us at this time?
Sure. Sounds like there's a lot of good community stuff going on here.
You want to speak in one of the microphones? Thank you.
Sounds like there's a lot of good community stuff going on here. It's good to hear. My name is Patrick Shannon. I'm the supervisor out at the Avera Dialysis Unit at Grassland Center. And we rely heavily on Palace Transit. You transport 42% of our patients. So we greatly appreciate what you guys do for us. And we've had steady growth. Avera opened in the hospital 4 years ago, and we had 12 patients. Currently, we have 36. Unfortunately, dialysis is a growing industry. Everything in the state is full, everything out west. So now they're shipping patients our way. And
People moving here from West.
right. And so we're one of the only units that's 6 days a week that have openings, so naturally they're filtering down to us. And on Monday, Wednesday, and Friday, we're filling up. Did you guys want to see a copy of our schedule? Would that help any? Or I don't have quite enough for everybody.
We can share.
But on Monday, Wednesdays, and Fridays, we treat around anywhere from 22 to 23 patients. And we start at 5:30 in the morning, and then we go until about 5:30, 6 o'clock at night with some of our patients. And the bus has been doing a phenomenal job. But with our growth, on Tuesday, Thursday, Saturday is where we're putting a lot of our new patients. And with Palace Transit having shorter hours on that day is starting to affect if we can accept new patients. We're still able to do that right now with a couple, we have a couple openings that we could use. But I guess what I'm here to ask is if you would consider on Tuesday, or at least on Saturdays, if we could possibly start like at the same time we do on Monday, Wednesdays, and Fridays. This would allow us to start patients earlier and to stack them like we do on Monday, Wednesdays, and Fridays, where we have 2 people per chair. We could stack the patients and we can receive more, which gives you more riders, gives the nursing home more patients. Everybody kind of benefits from that. But I was just wondering if that's something that you would consider doing at this time. And as we keep growing, maybe we'll even have to talk about running later on Saturdays too. But for now, we're just wondering if it's possible you could start earlier.
Can you give us a number
As far as,
of how many would they would transport, would be transporting?
well, to give you an example, on Monday, Wednesdays, and Fridays, right now you're transporting 10 patients for us. And on Tuesday, Thursday, Saturday, we're down to 5. Now, of course, I can't guarantee what our growth is going to be, because with our industry, it's kind of like the stock market. It's going to go up and down with our patient load, but with the hour earlier in the morning on Saturdays, at least that guarantees us that we can have open spots for when those patients do come.
I can give a little background. Pat did contact me this summer about this, and I said, yes, but I need to know the information so I could run a cost analysis, because I wasn't going to bring it to the board, I'm sorry, unless I had the information. He did reach out and send a letter with the same information he did present. And then Joe reached out to him again, Joe Hansen at our office, and she said, we cannot run a cost analysis. Oh, sorry, this was on September 4th. We cannot run a cost analysis based on this information. I need to know how many passengers will be riding, what type of passengers, wheelchair, et cetera, and where they'll be riding from. And if we are to operate during the 5:30 a.m. to 7 a.m. hours and 4 p.m. to 5 p.m. hours, we need to know if Avera will guarantee these rides or if they're willing to pay for any difference if incurred for no rides. And then she said the next board meeting was September 12th. I've kept this information with me just
Yep.
in case because we have not received any information for you
Yeah.
regarding to
on-
running a cost analysis.
Yeah, and like I said, I can't guarantee how many people would be riding. If we would start on, we have at least 3 or 4 right now that we could start on that early morning shift. You know, that would, and then that would open up the spots for us to add more patients in the afternoon.
Would they be wheelchair,
They'd be
Medicaid?
wheelchair. Most of the
These are things
patients-
that I needed to know before the
Right.
meeting, so that way I could give it to the
Right.
board.
And most of the patients that come to us are nursing home patients, so they're going to be wheelchair patients. And like I said, but I can't guarantee how many there would be, but predominantly, they're going to be nursing home patients.
So what hours do you run now, and what hours are you asking for? Like, what time do you start on Saturday now?
We start at 7 a.m.
7. So the additional would be 5:30, an hour and a half.
Right.
Okay. So we can't probably help you at LifeQuest. Everyone's sleeping. You know, I just thought, I couldn't remember if, you remember the hours went down
And that was evening hours.
and if we had riders that would tack onto his, you know. And then I had a question for you.
Yes.
So if they're not able to do this, do you have like a plan B? I was thinking, do you have like volunteers that could help bring people? I don't know.
I don't have volunteers. The only thing I could possibly do is go to the nursing homes and see if, because they have their own vehicles, to see if they could start transporting patients.
Yeah.
They do have their own vehicles
Yes.
for
Yes.
transporting?
Yeah, because like at LifeQuest, we bring people there and, you know, sometimes we transport them ourselves, so. I was just trying to think, you know, if it doesn't work, I mean, for example, they had to trim back some hours and that affected some LifeQuest people, but we understood that, you know, based on the cost. It was basically only LifeQuest people using the bus and it wasn't enough to cover their costs, so.
Right.
You know, I'd be interested in seeing,
If we could run a cost analysis, that's what we need to know.
Is there, what other information, I mean, like I said, I can't guarantee a number. I can tell you that they're going to be predominantly wheelchair, nursing home patients.
We
Is
would
there
need-
any other information I can give you?
We would need to know the age of the Medicaid, if they're wheelchair or not, if, like, approximately how many of you would think you'd send 4 within that hour and a half, or if you would send 1 within that hour and a half. We would need to know that kind of information.
Okay.
We did, just so you know, we just got our budget from the state, and it starts October 1st. So it's not, we wouldn't receive any money from the state for this right now, because our hours and budget has already been approved by them.
Okay.
So this would have to be out of our pocket, which is city funds, and our budget from the city has also been approved. So we'd be going over budget for this.
Okay.
but
That's why it would have been better if you would have came to us this summer when I asked for the information.
Yeah, I was trying to gather that, and unfortunately with our growth, and we've been so busy, and then they've also had me working out of town, I apologize. And I wasn't trying to surprise you here, I just, I wanted to open the discussion at least so we could get
We
started,
appreciate that.
so.
So is the Saturday back end hours fine? It's, the only thing you need is 5:30 to 7?
Yeah,
You're not asking for anything on the back, like.
At this time, no.
We run long enough for you to.
yeah, if I can get the 5:30, I can move these patients up, and then that will allow me to start putting more in the afternoon. And hopefully, you know, that will work for us for a while, so.
I'm a finance director, so.
Oh, that's
why I
okay.
asked.
That's fine. Anything I can do to help.
And I've heard the same thing Chrissy's heard. They're moving from the west. They're full out there. I
Yep.
mean, I have family members out west of the same thing. They talk about how they're full and
Yeah.
moving here. We have the need. Our community definitely has the need.
Do you think that if you did if you got the information, you did a cost analysis, and you said we would be short X amount, then ask them, would you be willing to put in this amount? I mean, is that even possible?
I'd have to check with my managers in Sioux Falls. We're run by McKinnon,
Right.
so I would have to ask.
Oh, yeah.
I would have to ask them.
But, you know.
And that's what I would need to know, absolutely.
Yep.
Then you would have the service, they wouldn't lose money. I would think that would be reasonable.
Yep, that's it, and I will pose that question to them, and I will get you the information that you need.
Perfect. Thank you.
So, yep. Any other questions that I could answer, or?
I'm glad I kept this in my folder.
Yes, thank you.
This dialysis is to both places, right? Grassland and Davita?
What's that?
That you need transportation to both places?
No, I just
No,
do
this is-
grassland.
Just Grassland?
Yep, I do the Avera unit. Yep,
That's all you do?
Yep.
Okay.
yep. So, and if you could do me a favor, if you could resend that to me, just so I make sure that I fulfill all your needs for that and get you the information, so. All right, and, thank you.
Thank you.
Thank you.
Okay, department reports and updates.
It says Taos Transit, they didn't have any reports at this time, so we're gonna.
Skip on that one.
MVP,
That works.
and it just has the report as to what the volunteers were doing all last month. And it has the total enrollment and hours report, that was a lot. We had a little problem with our software, we have to update my computer to Windows, and we kinda lost our software, volunteer software program, so it's gonna be a little.
Well, first of all, Amy we lost everything, like all the volunteer information.
You just restore it from the backup.
Oh, no,
Whoa.
You need a new IT guy?
Well,
The program isn't compatible
with Windows 10.
with even Windows yet.
There's ways around that.
Well, we got there.
We got the stuff, but we still can't use the
Program.
But we at least got our information.
Yes.
Okay.
It was a stressful
If you
last
need
couple
help,
days.
I'm willing to, if you ever run into something.
We got everything now
I
merged
help Bonnie,
into.
so I can help you.
Thanks. We got everything merged over to Excel at least. We got the information
Oh,
back. Thank goodness, because we were not happy. It was a stressful last couple days trying to get the
Yeah.
information.
20-plus years of information.
Oh. Yeah.
Had to be gone.
Yeah.
Was it in Windows? 'Cause-
No, it was in this
Oh, I
volunteer
see.
software.
It's a software program that
and
we're
then
supposed to pay for. Put it that
just,
way.
I would make sure you have a backup that backs up that database.
Well, now we're good now because we're not going to use this software anymore. Everything's on Excel. We got it the hour before we came here. We got all the information.
Oh, okay.
So it's all in Excel now. We have it saved. It's just going to be a different process than what we have been doing because it won't be in a software programming.
It ain't gonna be a new view of a process.
Now it's all backed up. Now we got it back.
But anyway, so that's the last report
Okay.
that looks like that you'll get, but you'll still get reports. And then we have the nutrition, shows for October that we were down 133 meals.
From projection.
Yeah. Shows where we're at with the dine cards, how many dine cards, the second meals. And they've picked up a little bit, the second meals have, since it's gotten colder out. People have started getting their meals again, so.
And with the Thanksgiving meal too, our numbers will skyrocket.
Where will that go as a, like regular, like they were eating at the,
Yep.
at the center?
Yep, she'll put it as a JVCC meal, but
Okay.
then we'll probably put another line in here.
Okay.
That way you know
We need
what
to
that
see.
is. Yeah. Yes. And they put together their report. We've had some discussions about operating during our normal times that we have been operating. Our attendance is decreasing quite a bit. We're trying to really make this a community center. So we're going to explore the possibility of, continuing our daily operations and having what we do, the card games, but not putting so much time and effort into events like a Valentine's Day party or a Halloween party. Maybe just have, you have your day there, but you're only getting 20 people in, and maybe doing something in the evening where more people can attend. So that's what they're trying to increase our community partnerships and expanding those kind of opportunities for our community and really making it a community center. They do put a lot of time and effort and resources into these day lunchtime parties, and again, they get 20 people.
Yeah.
I know I've had different people ask me about evening. I thought they were gonna have people in the evening, but nobody's here. So perhaps
And that's what they're going to try to
advertisement
doing.
of some kind, I don't,
That's why they're going to try to do activities.
Yeah.
And, this day will be, we're going to have this event. Come on out. It's kind of like they do at the bingo. The Jammers Nights are really popular.
Right.
People are coming out. So we're going to try to do more of those kind of things. It won't just be we're open. It'll be some kind of activity.
Mm-hmm. That sounds good.
I think a lot of the limited interest in noon hour activities is the time frame. You've already been there an hour
Right.
meal and then what you going.
Yep.
yeah, a lot of them have to leave to go back to work.
Any other questions about their report?
United Way campaign, we were down.
Yes.
Hmm.
Did not meet our goal this year.
Hmm.
You mean for your employees?
This is members.
Members.
Yep.
Members.
Oh, I thought you said United Way.
It's a United.
It
yes,
is United
We
Way.
do a fundraiser at the JVCC for the United Way, and we have a booth, and we ask members to contribute to the United Way to
Right,
donate.
and so you didn't reach your goal?
Our
from
goal
them.
the goal we set for our members was
Yeah.
2,500. and
Yeah,
they
we
never
set a
met.
goal for LifeQuest employees too, and,
Right.
Okay.
I'm guessing they made it overall, but we'll find out tomorrow.
We'll find out tomorrow.
Is anybody going to that tomorrow? I'll be
I will be there.
Okay.
Bonnie's one.
I'm going to for Mass PD, so.
I'm not presenting this year.
Not.
Well, last year I found out the day before, so.
You still got a few hours now.
I remember you did really well.
Yes, you did.
It was very last minute. Amy, grab me some information.
And I'm like you, last minute doesn't work.
Anybody have anything else to add? Next meeting date, we meet in December or not?
So we will not be meeting in December. I will be at a nutrition directors meeting for the state of South Dakota. So we'll meet in January. January 9th.
Uh-oh, I won't be here.
You're gonna be on a trip, aren't you?
No. I'm gonna get surgery done on this stupid shoulder again. And that is the day, this is the second time. I did it 3 years ago.
So December 12th isn't gonna happen.
Right.
We'll adjourn the meeting.
Thank you, everyone.
Thank you.